Okay, Mr. Stevens, let's talk about heparin. Heparin is an anticoagulant you're on right now because it helps prevent blood clots. Right now you're at rest, you're in the bed all the time, and this causes an increased risk for you to develop blood clots, which is dangerous because, first of all, it can stop circulation to your limbs or to important organ or any organ. And if a clot forms, we also have an increased risk for strokes, and we don't want that because we're trying to make you get better. And so the doctor ordered 50,000 units of subcutaneous heparin for you, just for the clot prevention. But because of it, we will also be checking in your labs your APTT, which is a fancy word to see how long it takes for you to create blood clots. And we're also going to be looking for any signs of anemia that you might have, or any bleeding, especially because you have incisions on your head, on your A-line, and you're just exposed. So we don't want you to bleed either. I'm going to be monitoring those signs that tell me that you're at risk for bleeding for 2 or 3 days. And yeah, this is all again to prevent blood clots. Also, I want to talk to you about your main diagnosis, sepsis, while you're here. So you had a fracture and you were having dressing changes at home. So what probably happened was that it got infected and your infection became systemic. So it went to all of your body, and instead of your body being able to target the place where the sepsis is, which usually is your body causing inflammation in the site, having a lot of white blood cells get there, having a lot of clotting factors get there to isolate the place where the infection is. Your body was doing this, but then it became systemic. It went to all of your body, and it caused your blood pressure to drop really bad. It caused your level of consciousness to drop, which is what your wife was mentioning when they first brought you. And so what we did was put you on a ventilator so that you could keep breathing. You're having fluid replacement so that your blood pressure can come back up, and you're also on antibiotics, and so that we can treat the infection that first caused it, and hopefully you'll be back to normal soon. We'll be weaning you off the ventilator, and definitely watching for any signs of infection in that site or any site, and making sure you're not at risk for bleeding, because both the heparin that you're receiving and the sepsis itself put you at risk for bleeding. Okay, I'll be definitely checking up on you for that, and you have the car light in reach and gloves on the floor.